I enjoy walking. I love to walk. I enjoy hiking and fishing and doing anything possible with the grandkids. The last year and a half, I was limited to hardly doing anything. The pain going up to my hip, just because of the knee, it was excruciating. So finally, I couldn't take it.
So when I saw Meg in the office, I knew that there was a problem because she had pain in a specific area. When I got the x-ray, it was obvious that she had what we call a periprosthetic fracture, which is a fracture of the femur, the thigh bone.
I had it replaced in May. There was a rod in the bottom and a rod in the top. And the rod in the top broke my femur, and that's when I went to Dr. Stenger.
It's a devastating type of a problem because it requires some pretty extensive surgery. And we decided to go with treating her with a large plate and screw that spans from her knee up into her hip. The recovery time can be double what it is for a primary knee replacement.
Awful afterwards, but my leg now is amazing. It's stronger than it's ever been. I can walk a good 2 to 3 miles without no problem at all, and it's only been 6 months after it.
When I see a patient that I've operated on out in the community, it means the world to me. Most of the time they're able to do the things that they want to do, and that's what I care most about in doing what I do for a living.